Ever wonder how lab safety or using a microscope fits into your future career? In this video, we'll show you how the skills you will learn in your first microbiology laboratory section are more than just steps in a lab. They're the building blocks of safe, effective healthcare. The first section of your microbiology laboratory focuses on some foundational concepts and practices used in microbiology laboratories. You begin with laboratory safety so that you are equipped to properly and safely work with the microorganisms to be studied in future sections. You also spend some time getting familiar with tools and equipment employed by microbiologists, including the microscope, media used to grow bacteria, and the tools used in the collection or transfer of microbial samples. You finish with aseptic techniques, which are important in ensuring that we do not contaminate ourselves, our samples, or the environment around us. An understanding of the topics covered in this first section will prepare you for your future allied healthcare profession by giving you an opportunity to develop the skills necessary for preventing contamination, handling specimens properly, and supporting accurate diagnosis and patient care. How are these topics clinically relevant to your future career? Many of the laboratory safety protocols used are similar to those employed in the healthcare field, such as proper hand washing, use of PPE, and proper disposal of biohazardous materials. The aseptic techniques covered in this section are part of laboratory safety, but are also critical to the prevention of the contamination of cultures. The aseptic practices learned in the lab will be put to practice in your career when you carry out tasks to prevent contamination or infection during procedures when caring for the patient. This might include the aseptic insertion of a catheter, the proper cleaning and preparation of the skin for an injection, or cleaning and dressing a wound care. The practices learned in this section are mirrored when you are tasked with collecting patient samples, whether it be blood, urine, sputum, or other sources. The clinical relevance of microscopy is often less obvious for students who have set their goal to become a healthcare professional. Learning the proper care and use of the microscope is a starting point for helping you learn to use other more sensitive diagnostic instruments such as EKG monitors, otoscopes, dental intraoral camera, and many more. Now that you've explored the connection between what you'll learn in this section and its clinical relevance, you're ready to head into the lab and begin developing the skills you'll later apply in your career. This hands-on practice is the foundation of professional competence and lifelong learning in healthcare. That's a wrap on the basics. Until next time, wash your hands and keep your space clean, because sharing is caring, unless you're sharing bacteria.